Pramoxine is used to temporarily relieve itching and pain caused by minor skin irritation such as minor burns, cuts, scrapes, sunburn, eczema, insect bites, cold sores, or rashes from poison ivy, poison oak, or poison sumac. It can also provide relief for itching and discomfort from hemorrhoids and certain other problems of the genital/anal area, such as anal fissures and itching around the vagina/rectum. Pramoxine is a local anesthetic that works by numbing the skin to block the feelings of pain and itching. This product may also contain other ingredients including skin protectants such as calamine, zinc acetate, and zinc oxide. It's important to read the package instructions carefully before using this product to ensure it is right for you. Do not use Pramoxine for skin irritation in children younger than 2 years or for hemorrhoids or other genital/anal conditions in children younger than 12 years unless directed by a doctor. This anti-itch lotion is only for use on the skin as directed by your doctor. Do not apply on severely broken skin areas such as open wounds, deep cuts, or serious burns. If you are self-treating, follow all directions on the product package. Gently clean and dry the affected area. If you are using a lotion, spray, or foam product, shake the container well before using as directed on the label. For skin irritation, apply to the affected area usually up to 3 to 4 times a day or as directed by your doctor. For hemorrhoids or other anal conditions, apply the medication to the affected area usually after each bowel movement or up to 4 to 5 times a day, or as directed by your doctor. Do not use this medication inside the rectum. Wash your hands immediately after use, unless the area being treated includes the hands. Do not use this product on large areas of the body or use it more often than directed. Do not get the product in your eyes, nose, ears, or mouth. If the medication gets in these areas, wipe it off and rinse right away with water. Stop using this product and tell your doctor if your condition worsens, if symptoms do not improve within 7 days or last after 7 days of treatment, or if symptoms clear up and return in a few days. If you think you may have a serious medical problem, get medical help right away. If you experience burning or stinging after applying this sensitive anti-itch lotion, it's important to let your doctor or pharmacist know. However, most people using this product do not experience serious side effects. While allergic reactions are rare, it's crucial to seek medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can report side effects to Health Canada or seek advice from your doctor. Before using this lotion, make sure to inform your doctor or pharmacist if you are allergic to Pramoxine or any other ingredients in the product. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have deep, open, or puncture wounds, broken, damaged, or blistered skin, animal bites, or serious burns. If you are using this lotion for hemorrhoids and experience bleeding from the rectum, stop using it and consult your doctor immediately. Before undergoing any surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication while breastfeeding. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If this lotion is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember to keep this lotion out of reach of children to prevent accidental ingestion. Narration: it is important to use this lotion as directed by your doctor. It can be applied to the affected area as needed, up to 4 times a day. Make sure to follow the instructions on the label and consult with your doctor if you have any concerns. Remember to keep all medical and lab appointments as advised by your healthcare provider. If you forget a dose of this lotion and you use it regularly, apply it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and use the next one at your regular time. Don't apply double the amount to make up for the missed dose. When using sensitive anti-itch lotion, it is best to store it at room temperature. It's important to check the product package for specific instructions on how to store it, or you can ask your pharmacist for guidance. Make sure to keep all medications away from children and pets to prevent any accidents. Also, do not flush the lotion down the toilet or pour it into a drain unless instructed to do so. When the lotion expires or is no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.